tooth cracks and fractures rank the third leading cause of tooth loss in dentistry. Cameron first warned the dental community about this issue back in 1964, calling for a greater awareness. Currently, the problem of cracked teeth is viewed as a silent epidemic. In 2007, Hilton and Farrakhan reported a 66.1 prevalence of cracks in at least one molar tooth. And the rate in 2020 is 81%. We also know that 40 to 60% of intact posterior unrestored teeth may have a cracks, or they do have a cracks. Hello, I am Marwan Awaraz. When clinicians think of the issue of cracked teeth, they most often think of the following: root fractures, oblique, vertical, split teeth, cusp fractures. However, I want to offer a different perspective, a perspective that highlights the dangers of this narrow view. Root fractures occur in 13 to 20%. Split teeth, 3 to 7%. Cusp fractures incidence is 15 to 20%. Most interesting that all of the above, in reality, are the final collapse stage of what undiagnosed, overlooked, undetected, misdiagnosed line crack. The term line crack, which I use in all the master classes we present, is not new. It's the condition first identified by Cameron in 1964, the famous cracked tooth syndrome. The masterclass series we present explores the reasons why this issue of cracked teeth is more severe today than back in 1964. Because today we have a vast amount of terminology, mixing cracks with fractures, many classifications, and to be honest, the most serious clinical deficiency is we were never systematically taught how to exclude them. We discover them accidentally. We underestimate their importance. And when a crack is identified, our focus in traditional teaching goes on symptoms: stabilize, temporize, monitor, wait and see, do a bite test. And when the pulp is involved, we proceed with the standard endodontic treatment that makes things worse. And we place crowns which make things worse. And why is that? Because all of these performances occur because we never been taught to understand the crack, why it happened, what it might become. And this is why this presentation highlights the concepts. This is a different approach. It's a structured diagnostic philosophy. It's not a technique. These master classes I present answer 4 important questions. What is the crack? And that is answered with the presentation 3x3 classification. Why did it occur? That is answered by heroic etiologic framework, EROIC. And how we diagnose it? We use the 4ROD protocol. And how we interpret it clinically? We use the ROTC, rule out tooth crack, diagnostic method. In addition to that, we have the MADA approach concept, which we try, it's a theory, to explain why 40 to 60% of intact, unrestored posterior teeth have cracks. I conclude this overall view with the BioSeal stress-free RCT for cracked teeth and the additive prosthodontics, not the traditional making crowns, for atraumatic restorations of cracked teeth. Let's get started.